So integrative medicine is a big term. In my practice, we do a thorough evaluation looking at people's gut health. We look at their immune health. We look at their hormonal health. We look at their overload of chemicals and toxins and metals. Do they have chronic viruses and bacteria? Do they have chronic Lyme disease and other organisms similar to Lyme, what we call co-infections? Do they have trouble with molds or what's called mycotoxins? And we go on and on and on. Do they have stressors that we need to address and to deal with? To look at a whole person, to get them in line, to get them balanced so they can begin to heal. And so we can then come up with a personalized approach for each patient in the integrative medicine space. And I think this is very, very exciting. The other area that's really exciting to me is what's called genomics, is trying to sift out, are there certain genes maybe an individual person has that is contributing to them not feeling well? For example, not breaking down certain proteins, or not being able to detoxify certain medications, or making them susceptible to heart disease or stroke. We do an in-depth evaluation looking at some of the key risk factors before diseases arise. And I think that's really important. Preventive medicine in this field is emerging now. Not just checking your cholesterol, I think that's preventive medicine, because that's really not. But we're going beyond the typical risk factors. We're looking at inflammatory markers. We're doing a special test now, it's called Gallery test, looking to see if you have signals of cancer before cancer even might arise, years before perhaps. That's very important because 50% of our patients, 50% of Americans, I should say, unfortunately are developing cancer in the US. That's an epidemic that we're not even addressing right now, and it needs to be. But there's special testing we're doing to see whether or not are there certain early signals of cancer that we can test by measuring something called cell-free methylated DNA patterns. This is not being done in traditional medicine practices. So in an integrative medicine practice such as myself, we're able to look at patients and come up with a whole plan to address risk factors before these risks and diseases even arise. And we're doing that with cancer, we're doing it for heart disease, we're doing it for so many illnesses today. I'm doing a special test called True Age, which is looking at your biological age versus your chronological age. And so if we see that someone's aging too rapidly, there's things we try to do to intervene, to slow some of the pathways in the body that may be related to aging. We know that Alzheimer's and dementia is growing rapidly in this country. So we have a rapid growth of cancer, a rapid growth of dementia, a rapid growth still of heart disease, because we're not getting at the root causes. We're not truly doing preventive medicine, which is what we really need to do to address our healthcare system and get us out of the rut of just pharmaceutical agents once we have the disease, to cover them up, because that's kind of what's being done in the traditional world. With a good, thorough, integrative, and functional and biological approach, we can pick up disease risk factors well before the disease actually arises.